It's one thing to talk about data, but I think we have to do much more than that and find serious ways of genuinely engaging the community. And remember that this is literally a matter of life and death. I mean, literally, not as an expression.
We're here to serve the community. Lives are affected, impacted, and changed as a result of us being in the lives of our patients, who would otherwise maybe not even survive another year. Our role is important because we know that we're dealing with human lives, human beings, and that's exactly what Steve taught us. We have to treat these people as if they're our own family members, like they're our own sisters and brothers, because they are.
The transition from a traditional medical care organization to a focused attempt to improve health status had been something that Sinai had been chasing for decades.
The undeclared original mission statement was to improve the health quality for the communities surrounding the hospital. That broadened out into not only helping with health disparities, but working in the communities with local people, hiring staff from the communities to work on the projects with us, listening to what the people in the communities had to say about what their needs were.
We knew the value of data and evidence, and we began to build it and use it in order to bring resources to address patient and population health needs.
We started in really digging into that data on a hyperlocal level, using our epidemiology skills to really understand what's happening at a community level. Not just what are those disparities, but what underlies those disparities, which then led us to conceive the first Sinai Community Health Survey that really tried to get more at the context of health inequities.
Over the years, we've been able to show that we're consistently taking the advice of community members, soliciting the advice, hiring a diverse team, because when you put out data on health disparities, which we've done regularly for 20 years, you have to be careful so that nobody can misinterpret it, so people can't think, oh, that's a race difference, maybe it's genetics. No, it's not genetics. The difference is racism and other structural factors. And we're careful to point that out consistently.
Research that sits in a book on a shelf doesn't do anybody any good. You have to get the research results out into the community, discuss it with the community members, and encourage them to work with you to solve these problems.
When I think about SUHI's founding, I always think about how innovative Sinai was to establish a community engaged research institute 20 years ago. That sort of concept of really needing to understand what's happening in community and really outside the four walls of the institution to drive what's happening within the institution is very novel. It's something that we do now, but that wasn't the case back then.
We had to find a way of having someone who had the rigor to carry out this kind of effort.
Steve was really at the vanguard of so many struggles. He knew that in order for something to be meaningful, and particularly for research to be meaningful, it had to be centered and rooted in communities.
He was the visionary. He thought what was possible, he knew what was necessary, and then he put it to work.
It really takes a special human being to understand that it's a matter of life and death. And we want families to understand that we're not just here because we get paid. We are actually here because we care.